Thank you very much, Mr. Speaker. And with permission, I'd like to make a statement about the work to tackle coronavirus. This virus continues to spread. Yesterday, there were 7,108 new cases. However, there are also early signs that the actions that we've collectively taken over the past month are starting to have a positive impact. Today's REACT study from Imperial College suggests that whilst the R number remains above 1, there are early signs that it may be falling. We must not let up, but people everywhere can take some small hope that our efforts together may be beginning to work. I put it no stronger than that. Cases are still rising. However, as the Chief Medical Officer set out yesterday, this second peak is highly localised. And in some parts of the country, the virus is spreading fast. Our strategy is to suppress the virus, protecting the economy, education, and the NHS until a vaccine can make us safe. Earlier this week, Mr. Speaker, we brought in further measures in the North East. However, in parts of Teesside and the northwest of England, cases continue to rise fast. In Liverpool, the number of cases are 268 per 100,000 population. So together we need to act. Working with council leaders and the mayors, I'm today extending these measures that have been in place in the North East since the start of this week to the Liverpool City region, Warrington, Hartlepool and Middlesbrough. We will provide £7 million of funding to local authorities in these areas to support them with their vital work. The rules across the Liverpool City region, Warrington, Hartlepool and Middlesbrough will be as follows. We recommend against all social mixing between people in different households. We will bring in regulations, as we have in the North East, to prevent in law social mixing between people in different households in all settings except outdoor public spaces like parks and outdoor hospitality. We also recommend that people should not attend professional or amateur sporting events as spectators in the areas that are affected. We recommend that people only visit care homes in exceptional circumstances, and there will be guidance against all but essential travel. Essential travel, of course, includes going to work or school. Mr. Speaker, I understand how much of an imposition this is. I want rules like this to stay in place for as short a time as possible. I'm sure we all do. The study published today shows us hope that together we can crack this. And the more people follow the rules and reduce their social contact, the quicker we can get Liverpool and the North East back on their feet. We're also aligning the measures in Bolton with the rest of Greater Manchester, and I'd like to pay tribute to David Greenall, the leader of Bolton Council, for his constructive support, and the Bolton MPs for all they've done in support of Bolton. There are no changes to measures in West Yorkshire, West Midlands, Leicester, Lancashire, or the rest of Greater Manchester. It is critical that the whole country acts together now to control the spread of this virus. So please, for your loved ones, for your community, and for your country, follow the rules and do your bit to keep this virus under control. Mr. Speaker, by its nature, this virus spreads through social contact, and so it's had a terrible impact on the hospitality sector, who in good times exist to encourage that very social contact that we all enjoy. So we've had to take difficult but necessary decisions to suppress the virus. The only alternative to suppressing the virus is to let it rip, and I will not do that. So whilst I know that many of the individual rules are challenging, they are necessary, and there are those early signs that they're working. In the measures we've introduced, including the 10 p.m. restriction, we're seeking to strike a balance, allowing people to continue to socialise safely where that's possible, while reducing the social contact that the virus thrives upon. Elsewhere in the world, they've introduced an evening restriction and then seen their case numbers fall. And we know that later at night, people are less likely to follow social distancing. Now, of course, we keep all our measures under review, and we'll closely monitor the impact of this policy, as with all the others, while continuing our unprecedented support for hospitality businesses, like cutting VAT, support for the pay of staff, offering rates relief for businesses and giving billions of pounds of tax deferrals and loans. Mr. Speaker, our hospitality industry provides so much colour and life in this country, and we will do whatever we can to support them while acting fast to keep this virus under control. I know that these measures are hard and that they are yet another sacrifice after a year of so many sacrifices already. But there are some signs that what we're doing together to respond to these awful circumstances is starting to work, so don't let up. Let's all of us keep doing our bit, and one day, over this virus, we will prevail.
Thank you, Mr. Speaker. I thank the Secretary of State for advanced sight of his statement. The Imperial study today is indeed encouraging, but as the CMO said yesterday, we have a long winter ahead. Now, we know that sustained contact, especially in crowded, poorly ventilated spaces, is a driver of infection, and pubs and bars are an obvious risk. So I heard what he said about the 10 p.m. rule, but my concerns relate to everybody leaving the pub at the same time. So what action will he take so we don't see a repeat this weekend of people piling out into city centres, packing out public transport, sometimes all piling in to a supermarket to buy more drink? Now, we on this side completely understand the need for local restrictions, including in Merseyside, as he has just announced. I think it was probably too late for colleagues from Merseyside to get onto the call list this morning, but I think if they were here, they would be keen to press the Secretary of State further on the financial support for Merseyside. This is a region which is hugely reliant on hospitality and leisure, and we know that these restrictions extract a heavy social and economic toll, and so areas need financial support. Otherwise, existing inequalities, which themselves, of course, have a health impact and allow the virus to thrive, will be exacerbated. People need clarity as well. Areas like Leicester, Greater Manchester, West Yorkshire, Bradford have had restrictions imposed on them for months now. Millions of people in these local lockdown areas, like across the North and Midlands, just need some reassurance that an end is in sight. Many want to know when they'll be able to visit their loved ones. Many want to know whether they'll be able to visit their family over the coming school half-term, for example. Can he just confirm, has he now ruled out the so-called circuit break taking place across the October half-term, as was mooted in the newspapers last week? Also, some of the heaviest increases in infection appear to be taking place in areas where restrictions are in place. So why are the interventions not working? Why are the moles not getting whacked? Yesterday, the Prime Minister suggested that the success of Luton in leaving restrictions was because of people pulling together. But I've got no doubt that people are pulling together across Bolton, Bury, Rosendale, etc. So what additional help will they receive to drive this virus down? Now, I believe ministers lost precious ground in fighting the virus by not having an effective test, trace and isolate regime in place by the end of the summer. Testing and tracing is key to controlling the virus. Increasing evidence now shows that the importance of backward contact tracing in controlling outbreaks. So could he tell us, is backward contact tracing routinely happening in areas of restriction, and will he publish data on backward contacts reached? Now, we support the calls from the Health Select Committee today for routine testing of all NHS staff. Will he finally set a date for introducing it? But problems do remain with testing generally. I've just heard of a case in the Rhondda where people have turned up at a testing centre, have booked appointments, but Serco has pulled the testing centre out. And Serco are saying in that area they need the Secretary of State to intervene if that testing centre is to be reopened. Will he do that? Now, on the 8th of September, he told the Select Committee that the problems with testing would be resolved in the coming weeks. That was more than 3 weeks ago. Yet a test still takes 30 to 31 hours to turn around for in-person tests, 75 hours for home test kits, 88 hours, more than 3.5 days, for test results in the satellite test centres, which are predominantly used by care homes. So he hasn't resolved the problems. When will we? And today, we've learnt that Deloitte, who are contracted by the government to help run Test and Trace, are now trying to sell contact tracing services to local councils. So the government's own contractor, one of the very firms responsible for the failing system in the first place, now sees a business opportunity in selling information and services to local authorities. They should be getting this anyway, and this is in the middle of the biggest public health crisis for 100 years. Isn't this an utter scandal? How can it be allowed? Doesn't it once again show that directors of public health should be in charge of contact tracing? And finally, Mr. Speaker, this week GPs warned of significant problems with flu vaccine supplies. Boots and Lloyd's Pharmacy have stopped offering flu jab appointments due to issues with supplies. Can he confirm that we have enough flu vaccines available for all who will need one this winter?
Thank you very much. Well, I welcome his support for the measures that we've had to take, and the £7 million of extra financial support for the councils who are affected, not just Merseyside and Holton and Warrington, but also in Hartlepool and Middlesbrough. That's on the same basis as the support for the North East 7 councils that was announced at the end of last week. It is true that some parts of the country have come through a local lockdown. In fact, we've lifted many of the measures, for instance, that were in place in Leicester. We weren't able to lift all of the measures, and the case rate there did then go back up again, although it has now appeared to have stabilised. And Luton is another example where there was a very significant local outbreak, which was brought under control. He asked about increased testing. There is, of course, increased testing going into to Merseyside, and we can do that because we have a record capacity which has increased yet again this week. He asked about backward contact tracing. Absolutely, we have backward contact tracing in these areas. One of the reasons that we know, sadly, that the highest area of likelihood of picking up a case of coronavirus outside your own household is in social settings is because of backward contact tracing. So there's further information that Public Health England will be publishing today on further work on backward contact tracing to understand how this virus spreads. He asked about the speed of test results. I'm glad to say that the speed of the turnaround of test results in care homes is speeding up. He asked about Deloitte and their contact tracing capabilities. Deloitte have done an incredible job in helping us to put together the contact tracing and the backward contact tracing that we have. And of course they should offer their services to local councils too. On the one hand, he says local councils should have more impetus and more involvement in the contact tracing. And then when a company with great experience in contact tracing comes forward to offer their services, he criticises them. I mean, they can't have it both ways. And of course, these services cost money and they have to be delivered. And I pay tribute to Deloitte, who are doing such a brilliant job. Finally, he asks about flu jabs. And it is absolutely true, as he says, that there is a record rollout of flu jabs. There are enough flu jabs for everybody who needs them in the priority group. I would stress that this is a rollout. Nobody needs to have a flu jab before the start of December. You can have it in September or October. It will then cover you for the winter. And so we are rolling it out, and more appointments will become available in good time. We've got 30 million jabs in total. That is more than we've ever had before. It's almost double what we've typically had in the past, and those are available. I'm really glad to say, Mr. Speaker, that record numbers of people are coming forward to get flu jabs, and I welcome that. But people, as the Royal College of GPs have said, people will have to have patience. They will, if you're in the group, the target group, the over 65s and those with clinical conditions, there are flu jabs available, and it will take us the coming weeks in order to make sure that the people who need those flu jabs can get those flu jabs.